on. We're gonna have a great show. We had 3 great guests, but tonight again we're here for one young lady, and who has an awesome story. Who's done great work in the city and the state and the county. But again tonight, I want her to introduce herself, introduce the panel, and then we'll go straight to this young lady and we'll start taking questions. But introduce yourself to the audience.
Great. Well, thank you so much for having me. And I like first calling me young. Don't you like that, Margaret, too?
We are young.
I like that. I like that. I like that part. But no, I'm State Senator Bethany Hall Long, and I know I've had the privilege being on here with the show before, particularly with Tova and serving on the sickle cell board. But, you know, Julie, just a quick introduction is, you know, I'm first a mom, senator, and a nurse, teach at the University of Delaware, and have the privilege for 14 years, 6 in the House, 8 in the Senate, as serving as a senator and a House member. And it's covered the lower area of Newcastle, up in from Middletown to Newark, and then also in Kent County. We've been in the area of Clayton and Smyrna. But as you indicated, and as Senator Henry will share with you, we pretty much cover the entire, you know, state when you're addressing policy issues, such as myself chairing the Health Committee, chairing Community and County Affairs, which actually deals with all 57 municipalities and a lot of the energies here in the city. So I can fill in a little more in a minute. I know you want to go and hear from the other guests too.
Yes. I'd like to introduce yourself.
First
you don't
of all,
need no introduction.
thank you, Julius, for having me on the show tonight. And I'm here to endorse formally my good friend Bethany Hall Long.
Thank you.
Senator Hall Long has sat next to me for the last 8 years, whispering in my ear. No, but seriously, I have been up close and front and personal, and I can really attest to her integrity, her ability to get things done, and I know that the day she's elected, she will hit the ground running. And so I'm just pleased and honored to be here to endorse her tonight.
Thank you. And you forgot to mention you're a leader in the Senate.
I'm a leader because I sit next to her.
No.
No, but she isn't. The thing about Bethany is that she shares everything. And so she doesn't always need to take the leadership role in things. And she frequently encourages me to do things that she could certainly have, is more of an expert on. And I appreciate and I respect her highly because of her integrity in the work that she does.
Thank you.
This young lady, introduce yourself.
Hi, I'm Dr. Anderson. I'm the Executive Director of Tova Community Health, a sickle cell specialty center, which is now housed at the Henrietta Johnson Medical Center. And I've known Bethany for a long time because she was my nursing professor at University of Delaware. I'm dating myself. Bethany taught me nursing theory and made it bearable to get through that class. And I'm just proud to have seen her grown over the years. I remember when she was starting out trying to get us to go into public health nursing, and we were like, no, we don't want to do that. We want to work in the hospital. But was there when she ran a step rep to becoming a senator and now lieutenant governor. And I'm proud to endorse her, and I've seen her grown over the years, and she's been a great champion of sickle cell and the work that I've done as a nurse.
Okay. Also, again, my name is Julius Cephas. I'm the former president of the Port of Wilmington, but I like to endorse Bethany too. One thing the community may not know, when everybody's talking about the expansion, but before the expansion, the port was trying to be leased and sold. And I think in the Senate side, the first time it was 1 vote. And these women here, I called them constantly. And they got the job done. Thank God for Senator Marshall, never forget Senate Bill 3, but these ladies was on the battlefield. And it wouldn't be no expansion. They saved 16,000 jobs. Delaware would be like Detroit if it wasn't for these ladies here. And matter of fact, and I'm gonna go to you for your background, when we got the call that they pulled out with a city council, it was 10 men started crying. That's how serious this was. So again, we endorse you because the port would have been dead wasn't for you ladies here and everybody else in the Senate, because again, the first time it only won by 1 vote. But what I would like you to give a little background of yourself, and then we'll get into some other things.
Sure. I'd be happy to do that. I think you heard a little bit. First and foremost, you know, ever since I was really little, and Nina might agree to this, anybody who wants to be in public service or be a nurse, I knew from the time I was this high, growing up on a farm, like you said, in Sussex, with boys. I know a little different than the city, but I've had my time in the city here and many cities, because as I grew up, I married a man who was in the military. So I had the opportunity with him to live in different cities, you know, up and down the coast. However, the thing about me is I learned a little bit with also being on the farm. You know, you learn about caring about people, hard work, values, what you learn, having each other's back. And I think, as Margaret indicated, that's important. And to me, coming from a family of ministers, you know, it's also about all of us are created equally. All of us are equal. There's the same thing about fighting for social justice and, you know, in front of God's eyes. And so I always had that resonate. And I know Nina will tell you that when we take care of people, you know, we see the whole person and we relate. And I'm so pleased that I was raised that way. And I've brought that with me through my 30 years, Nina, 30 years of nursing experience. She wasn't even probably born, I'll say you were younger. But taking care of people and working in the nonprofit private community. And 20 years now, I've had the privilege of working at the University of Delaware. I'm a full professor, both in nursing and urban affairs. And there's a program in the state when we have an emergency called the Medical Reserve Corps. And I've been privileged over the past few years working with public health and a great staff, working with all municipalities across the state, public health, hurricane, flooding, if there's, knock on wood, mass shooting and casualty, we are first to go. So I've got a great team of over 600 volunteers, and many are from the city of Wilmington too, so that we're ready to go out in the community. And just like Nina and Margaret and yourself, you know, I think we're all an extension of the organizations we belong to. And so I've been pleased to belong to a number of different organizations that really meet the needs for people with chronic disease and health care and jobs, you know, and making sure that individuals have training and education so that they are prepared, so that they are employable, and that their families have food on the table, you know, besides addressing the issues of the heart.
Right. Senator, you want to say something?
I did. I just wanted to say that it's very hard to talk about oneself, but I would like to have the privilege of talking a little bit about Bethany, because one of the things that I admire most about her is that she never really toots her own horn about her accomplishments. And one of the things that happened as she was following her husband around when he was in the Navy, was it Navy? He was in the Navy, was that she had a chance to work in Washington, D.C., and people don't know that. But she did, and like she was a fellow on Capitol Hill. So she really has national experience, if you will, in terms of the issues that we're facing here in Delaware, but she never talks about that.
Yeah, I forget that part.
No, she forgets that.
Yeah, I did have the chance to work with, I worked with Thad Cochran, Bob Dole, Ted Kennedy, and that opportunity in Washington.
So you can go across the aisle
absolutely.
at any given time.
Yes, and I know Margaret's had this honor in the past too. This year, the Delaware State News, and again, it's hard to toot your horn. You know, nurses were used to having somebody else do, you know, working with other people. But, you know, the State News honored me this year for my ability to work across the aisle, which helped me to get the most pieces of legislation actually sponsored and passed this year, and that affect working families.
Now, also, normally, some of the things that we do, we get it from our parents or somebody in our life close. Like my mother was a social worker, and I watched her.
Oh, your mom is a spitfire.
She is awesome.
Yeah,
She's still awesome.
She goes down to business and over. She doesn't quit.
No, she doesn't. And I see here, your great-grandfather was the House of Representatives from 1916 to 1920. Can you talk about that?
Well, it's funny you say that because I never even knew anybody in my family was elected before me, because we come from a family of ministers. So you just talk about helping your neighbor, doing things for people, volunteering. We didn't talk much about politics. The day I was sworn in, my father says, well, you know, your great-grandfather used to take the train here. And I'm like, what are you talking about? So I did learn from Ocean View, Bethany Beach, hence my name, that he served. And, you know, service is important, and I think each of us would have a story. Your mom is a social worker. The thing people don't realize about me, they see a nurse and a professor. I come from a family who are farmers, and I'm the first person to go to college. I'm the first generation graduate. And my grandmom was my greatest influence. She had an 8th grade education. She had to quit working, work on a farm, till behind a mule because they didn't have enough money to have a tractor. And she had 7 younger siblings. And so her parents put her out, 8th grade in the field, and she always said to me, and I say this to the viewing audience and why I think I'm so passionate about women and mentoring young boys and girls for education. She always said, you have to have your education, you know, whether it was high school, college, because she said that's something that she had to struggle with. Even though she was a brilliant woman, it was her life, it made it harder for her. And so she was somebody I always looked up to. It was my grandma.
Okay.
And I just want to say too, when we talk about family background, my mother was a nurse, and she championed advocating for children with disabilities. Back in the 80s, she fought hard to get children access to high quality public school education at disabilities. And over the years, Bethany has never shied away from her brother has a disability. And I think it's important for the viewing audience to know that, because sometimes we don't see the salient issues that families face when they have a loved one who is disabled. And Senator Margaret also has a son who has autism, grandson. And so when I say that, it sort of makes you a better and a compassionate person when you can really understand the issues that families face when they're caring and making sure that their loved one has a quality of life, and they want their children to have access to a good quality education. And I can also remember her son, who is Brock, who's a wonderful child who has struggled, has a learning disability. And I can remember sitting in her office when she was just so frustrated and making sure that he was able to go to school and be able to get accommodations in the classroom so he could be successful. So we're talking about somebody that has experience, not just as a nurse, but as a mother and an advocate for people with disabilities.
I want the community to also understand that a lot of this good care that you see in Wilmington, Delaware, a lot of these students come from her. And she's put a lot of people in this city, state, and probably across the country who's come through University of Delaware.
It is amazing when I go door knocking now, door to door, how many I've taught, you know, several thousand, and it takes a village, as y'all, you know, it takes a village to get someone successful, and, you know, with Nina and her PhD, and Margaret with her work and her family, and I think that's what's great about Delaware politics. We are real people. Margaret goes to the grocery store, we go to the store.
I took my grandchild Halloween shopping, you know, I pick her up from school.
Let me say one thing about Senator Margaret Rose, and again, I want people to understand that a lot of times our relationships are tested because we all passionate about different issues, and we go at it, and we disagree, but Senator Margaret Rose has, to me, she is a psychiatrist. And these serious issues, I've always told you that.
Yes, you have.
And she sit back, and I'm a counselor, but even the counselor needs somebody to counsel them. And she sits back, and her advice is priceless.
Oh, gosh.
And I've told her that, and I'm just telling the public that. And again, don't think we always get along, because there's tough issues. There's serious issues, and we go back and forth.
That's what makes a better policy.
Right.
When you have to have differences, you come out with a better product.
And you know, one of the things I'm talking about, and I'm honored that you feel that way about me. One of the things that I love about Bethany so much is not only her compassion for her fellow man, but her advocacy. One of the biggest problems we have facing us here in Delaware, and probably in the nation, is drug addiction.
Yes.
And Senator Hall has been the champion for drug addiction in our state, and I hope she will talk a little bit about the work that she's done. She probably won't be able to tell you everything, but just the salient points that are so important for the public to know.
You know, and thank you. And Margaret's been right there, you know, because she is the senior senator and had the health committee before me. But I think together, you know, we have tried to make individuals in the community recognize, you know, that substance abuse or mental health, so it's mental health, behavioral health, is a disease. You know, people don't choose to be this way, and I know that the senator has worked really hard, and I've been pleased to co-sponsor legislation that we're not penalizing people, and perhaps we'll get a chance to talk about that, giving people their voting rights and opportunities back. But the mental health, behavioral health crisis really has escalated, in the last 5 years. As Julius indicated, I've been pleased to be on the street, so to say, and I know on previous shows when I've been interviewed, we've talked about some of those advocacy issues, whether it's dental care for the poor who need expansion with Medicaid, or if it is access to Narcan. One night we had Mr. Humes with attack addiction here, and Nina and I were in our red and black. We just came from, prior to this, an addiction coalition meeting that's being held right now by the administration down the street. And it's about opportunity to get people well. It affects everyone, all races, socioeconomic status, everyone, children, pregnant women, and it's tearing our communities apart. And Margaret stood side by side with me, chair to chair, when we voted on some tough issues. Narcan, it's very popular now. We've got the legislation. It's the drug that reverses when the heroin and opiate suppresses how we breathe. It brings people back to life. It is a lifesaver.
I seen it on the news and it blew me away. This guy was dead, out, calling his maker. And the police officers came and took it, boom, boom. And he woke up like, he woke up like he just woke up out of a sleep.
It's a lifesaver, and it wasn't an easy, as Margaret knows, the easy issues, you know, fly by. This took a couple years. It wasn't something we just did, and it takes the advocates. So the viewing audience, you know, we get our ideas, and as your next Lieutenant Governor, if I am successful,
You will be.
I will have an open door, and Margaret knows I'm on the phone and emails. You know, we want to hear from you, and we learned about Narcan through the advocacy of this father, Greg Humes, who passed away, his dad, and we did the 911 legislation with other senators that if you have an individual that you discover, you're with somebody who passes out, and you can take them, get them help before they were afraid of being arrested. So people were dumped in the ERs or left in the parking lot to die. So we've championed those things, and recently with the Attorney General, we're looking at the Drug Mortality Task Force so that we can learn how to approach the disease not as, you know, a crime as much as a disease. You know, certainly Margaret knows best from the Judiciary Committee chairmanship that we have made some changes, you know, to help people. You know, the 3 strikes law is gone.
Great.
Needle exchange bill, which was Margaret's baby that I was happy to champion with her. You know, so we're really trying to help because it affects everything.
Yes.
It affects the pocketbook. People lose their houses.
That's right.
Grandparents take on more children because the parents end up in prison. And, you know, we can't have this. I know Senator Henry was with us and Nina when we were looking at chronic disease, which I know we'll probably talk about in a minute. But the one thing I'll say is Senator Blevins and I did this chair of a task force, year and a half. We found 82% of our inmates have a mental health and behavioral health problem, substance abuse. So we had this great big report looking at mental and behavioral health and corrections and prison reentry, and we've got a lot of information there, and we know that has issues in the city that people worry about. So again, we could talk and talk and talk about Narcan and healthcare, and I don't know if these ladies have things I've forgotten.
I
Go ahead.
just, Senator.
No, I was just going to say, though, one of the most important things that the viewing audience needs to understand is that Senator Hall Long is running for Lieutenant Governor, and that means that she, if anything would ever happen to the governor, she would step forward to lead our state. And I feel so safe knowing that someone with her expertise and experience and knowledge and capacity to care could be governor if something were to happen. Now, I don't want anything to happen, obviously, to our governor, but it's just a very comforting thing to know, and it should be for the public to know that we're really in great hands, because we have a lot of challenges ahead of us as we begin our new year. We have some fiscal issues, we have some expanded health needs. One of the things I'm extremely proud about is that Senator Hall Long has championed dental care for adults. You know, we've been really big about doing things for children, but people forget how adults suffer from dental issues too, and they had no services, and she championed that too. There's just so many, many wonderful things that people don't know about this gracious woman sitting next to me who doesn't like to talk about what she's done. But I can tell you, we've never ever, in the 21 years that I've been in office, ever had anyone as prepared as she is to be Lieutenant Governor, and if she needed to assume the governorship, she could certainly do that.
Thank you. I appreciate
Well, it's the
that.
truth.
Appreciate that.
Yeah, and I just want to say too is that I have a newsletter that I put out, and I try to educate our community about some of the public health issues that not just Bethany but other state representatives and legislators are putting forth. And so I had an opportunity to talk about Narcan. And about 2 months ago, I was coming out of a restaurant in Philadelphia, and there was a man just laying in the street cold. And I happened to flag down the police, and I told him, you need to give him Narcan. And he said, well, I don't have it in any car. So he smacked him around, and he wrote back up. But it was a time, yeah. But it was time. It was a good way to educate him.
Yes,
and I said, you really need to carry
He
Narcan.
smacked the hell out of him, too.
Yeah.
She said, he said, I got to tell y'all the story. She said, get Narcan. He said, I ain't got none. Bang, bang, bang. You guys, okay.
I'm up. But what it did was a good time to educate him about the importance of having that available and accessible. And I never thought I would be in the situation where I would find someone. But I want to say that over 1,000 lives have been saved in the state of in Delaware because of her legislation.
And it was with the policemen and others, and we have the ability, there's a misnomer, we have the ability actually to eventually have that over the counter. It's written in the code, but we have to have in place the pharmacies and the pharmacists have to be prepared and ready to do that, and that's what the holdup has been. But our code allows our director of public health to write, because she's a medical doctor, to write that we can actually get this over the counter. The key is, though, when we have responders, we're really about treatment and access. And that's why Senator Henry and many advocates at home there fought recently that we open a new hospital specifically called Sun Behavioral Health. It's going to be downstate, but it will affect the whole state. And one of the main reasons is in Delaware right now, if you have a young child between the age of like 12 and 17 that's getting hooked to drugs, they have a temporary short stays they can do if they have anxiety or depression at our local facilities. But we do not have a substance abuse treatment center for 12 to 17-year-olds. This facility will provide that for our children. And we held it to them even at the bill signing. So that is another thing, you know, that we're trying to bring access to services to the state.
I think Delaware is going to be in great hands because you need somebody who understands the health side of it and who can fix it. And like I said again, I know how hard she works. I mean, matter of fact, she works hard. She's very task-oriented. Bang, she gets on something and she goes forward. Now, what I like to ask, do you think, I would like to see more treatments coming. You know, what do y'all feel about the treatment centers and some type of, even if it's something for 5 days to dry people out?
Right. Well, we have detox centers now. We don't have enough of them. And I think people have to wait too long, right, Senator?
They are waiting, and that was part of our report, and I'd encourage people, if they are in need, our state has a wonderful program, you know, Help is Here, or call 211. Senator Henry, I think, helped sponsor that legislation. Just dial 211 and Help is Here. And I really know that with treatment, if you look at our report, we don't have enough. There's outpatient, inpatient, day treatment. We're working on expanding that. We're working on the workforce. Part of it is eliminating the stigma so that parents and families aren't embarrassed. It happens to all families. You should not be embarrassed. People should seek care. Very important. And as far as treatment is concerned, part of it is the workforce. So you're a counselor, you know, expanding counselors, nurse practitioners, psychiatrists, child psychiatrists. It will come together. And again, the whole correction issue is a whole nother set of issues.
And one more thing, I believe, I'm not sure because I don't have the record in front of me, you probably going to go in as Lieutenant Governor, the most experienced Lieutenant Governor.
I don't know about that.
Well, I'm saying it.
I think in the 21 years that I've been there, yes.
I'm saying it because you were 6 years state rep, right?
Right.
How many years you state senator?
8, almost 9.
Okay,
Almost 9.
9 years state senator.
Right.
Professor at University of Delaware.
20 years.
I think you're going there with some serious qualifications.
Right.
That I've never seen before.
Yeah. And I appreciate that, and it's not like, you know, always the qualifications or the letters behind your name, but what Margaret says is in
the
your
work.
heart
That's
and
right.
your work. And to me, it's empowering. I'm one of those unique people, and Nina knows this because Nina's like this and Margaret is. We get energy from people. So those in the viewing audience, you know, if you've got a loved one, if you've got a problem, we do help individuals. And you're right, I was raised with a brother with a disability. My father was, due to an accident in a wheelchair, taught himself to walk after he was told he would never walk again. My mother had brain cancer. My other brother had cancer. So I've lived it, and that's why I coach here now, the Cancer Consortium, and I'm excited that our Vice President, when he returns to Delaware, is going to be working with the Moonshot. And we ladies spent a lot of time with Representative Stephanie Bolden, you know, this past year studying again chronic disease, which is a huge issue affecting the residents not only in the city but statewide.
And that's great again. I know how hard you work. I know how all of y'all work.
And you know, she could be the health queen, but she does a whole lot of other stuff too. And you know, she chairs county and community affairs, and that's another topic that we should really talk about because it impacts on people's housing, renters' rights, and things of that nature. So she's had to champion and advocate for equality for people. For example, those who rent manufactured housing, they actually never owned the land; they leased the land. But she fought to make sure that when there were rent increases, that they were justified. And I think that people don't know that. So she understands the landlord-tenant requirements.
Oh my goodness, do we? And for the city, you know, what it involves is me having to work with the local towns, or called municipalities, and everyone's different. You know, some of the Viewnots has probably never heard of Blades. You know, there is a town, you know, in the city, very small, very different. But it's a matter of working, and as Senator Henry indicated, because she serves on that committee with me, and she too has been a great advocate for people in need and protecting people, even having homeless rights, you know, working with individuals. And that's actually what brought me to getting in public service, was working with homeless veterans. Mentioned my husband was in the military, and working with a minister in Charleston, South Carolina, believe it or not, is when I had my first interest as a public health nurse. And I was in a community where I was the minority. You know, I was working, helping the population, and so they didn't have a voice. And the only way to have a voice was public policy. And it was the minister whose son, who was elected, who was shot and killed last year by the man in Charleston. That was just horrible. I worked with his mom, you know, helping the people. And it's kind of like the article I think you're looking at there. It's helping those who can't help themselves. And that's what probably brought Margaret to the table.
Oh, it did. And you know, the other thing too about people, I don't want to talk so much about health, but patients' rights, people's rights are important to Senator Hall Long. And I think that she champions to make sure that the underdog always has a voice. You know,
and our children, and we'll get back to that with the WEAC before we're over.
Can we go to a commercial show, Lieutenant Governor Bethany's commercial, real quick? Ivan? Okay, we're back, but I'd like to say one thing. I'm the luckiest man. I got 3 beautiful women, young women, intelligent, look good, powerful. What can a brother ask for? You know what I mean? Hey. But seriously, let's talk about the pardon board and all that type of stuff. What's going on?
Important issue. You know, the lieutenant governor, people get confused about what you do. And as Margaret indicated earlier, you fill in if the unthinkable happens. And one of the duties, real important duty, is the Board of Pardons. And to the viewing audience, you probably had to experience, some people maybe, with the Pardon Board. And it's just because we've not had a lieutenant governor, you know, some of the schedule's been delayed a little and some of the cases have backed up. So before the Board of Pardons, you go and there's a recommendation of a panel comprised of like Secretary of State, the auditor, treasurer. The lieutenant governor chairs the Board of Pardons, 5 members, and it's a process, and there's paperwork that needs to be filled out and can take time. I am committed, as your next lieutenant governor, to work with the panel of men. Right now it's all men, I'll be the woman. You women can vouch for me. I will push to, if they so agree, you know, to maybe lengthen some of the day so that we can hear more cases, to eliminate some of that backlog that's occurred. And not only does the Board of Pardons do pardons, it does commutations. And those are usually individuals who are coming in the correction system. And a couple things I do want to provide for clarity is that, you know, during the past election, we had great people running. I'm so excited to have support from my Democrat colleagues we've come together and unified, and I thank all of them for their support. There was a healthy dialogue around this, and there was a lot of good suggestions, and we should build on them. A couple, I'm not sure, it's been brought to my attention, might not be implementable because for commutations there is state code and issues if somebody's coming in shackles with children around. They may not be able to be like in a police athletic league. There was some discussion about having the meetings in certain community facilities. But I do think it's important. Pardons affect people's lives, their economy. It's serious business.
It's a game changer.
Serious, it's a game changer. And for those who also, unfortunately, are maybe on the other side, when you're talking commutations and maybe some more intense victims who've had experiences, you know, we have to make sure that the victims can be accessible, that they have the opportunity to be present. But at the end of the day, the majority are pardons and misdemeanors, things that people did at the end when they were young, mistakes that need to be rectified. They shouldn't be having to wait a long time. They should be heard. And I know Senator Henry and I have done the probation before judgment.
Correct.
And you might mention that because that affects a lot of the folks in the city.
The other thing too is that we're trying to, we passed legislation this time to really be able to have juveniles' records expunged, because that's a lot of the stuff. People did things when they were kids, and then they want to get their first professional job, and all of a sudden they realize they cannot because they've had to have a background check. But I think one of the things too is that unfortunately so many of the people who live in low-income communities end up in jail because of the lack of opportunities, the lack of education. And so no one wants to go to jail. No one says, well, I'm going to be a criminal and that's what I want to do. Right. But once they get there, we have a responsibility to make sure that they, one, get the help that they need, because I think Senator mentioned how many get there who have mental health or substance abuse issues. So if you don't treat them while they're in prison, you've not really rehabilitated them. Right. So we need to make a special effort, and I know that's part of her platform, is to work on rehabilitation while people are incarcerated, so that when they come out, they can re-enter society more prepared to be able to get a job and reunite with their families.
I know when I used to work for Governor Minner, I was a community liaison, and they had the KEY program, and they had some great
KEY and CREST.
Yeah, they had some great programs, and I will hope, you know, that you get a chance to revisit some of the things that was successful in the past.
And then Medicaid, the one thing I'll say, one recommendation and something I'm hoping will happen, I know they're looking at, is that Medicaid not be terminated but suspended. So that way when an inmate leaves, if he or she so chooses, they can go the next day and start in treatment with Medicaid. Right now, it can take 2 or 3 months. So they end up not getting the treatment. So I'm a real proponent, made the recommendation, Medicaid suspension, not termination. And you know, it's something we've got to do. And the Board of Pardons, one thing I failed to mention, that's a recommendation. It's a recommendation. The board only recommends. It's ultimately, as you know, up to the governor. Right. He or she makes the choice.
I think that's important, because I think there's been a misconception somehow that the lieutenant governor can pardon people. She really cannot. She would not be able to, but it would be a recommendation, and the governor has the final say, actually. Right. I think that's important that our listening audience understands that, because there's been a lot of discussion about this. Also, in regards to mental health and substance abuse and training, in our prison system, I think that's one of the things that the Senator's been really talking about. What can we do while we have people as the state's guests, if you will, while they're incarcerated, to really prepare them to come out and have a useful, productive life? And so in addition to the mental health and substance abuse counseling she's advocating for, I know that she's talked about teaching them a skill, a life skill, and she's been, you know, talking about whether
that's a huge issue.
That's a big issue.
Right. Training, workforce, and that's a whole other issue. The whole education system. You know, everybody. You know, making sure equal opportunity for all, training, workforce, the pipeline. Everybody, you know, deserves prosperity. Everybody deserves hope, and you know, we need to empower. And whether it's on our streets, whether it's in our communities, our churches, or as you said, guests, that's a nice way of putting it, guests in our prison system. We need to do more to not have reentry and failure. That lifts our entire economy up. And working with small business expansion, you know, that's one thing we've been, you know, haven't talked about, but a number of these individuals can be entrepreneurs in the new economy, making sure minorities get that equal opportunity for those loans for business. You know, we need to give people the opportunities so we don't have the life on the street that we have.
You know what I would like to see, and not putting the burden on the state, but I watched CNN's, they had the heroes, and this man and some private people, he was teaching people how to fix cars and body work, and one guy was teaching people how to be carpenters and all that. Out of 1,000 people, they all got jobs and never went back to prison.
And that's something, and that's what we
And
are
they said once you give a
hoping
man
to
a
do here.
tool, and again, I mean, so the state doesn't have a pick. I like to see them talk to private businesses and see can they donate some money and find some people who are retired, because so they won't go back to prison.
Right. And there are different programs, nonprofit partnerships, programs where they are working, but we can always do more. And I know we found that out when we did our complex chronic disease task force, right,
yes,
Nina?
Yes.
Go ahead.
And I want to thank Bethany and Senator Margaret for sharing that. As you know, sickle cell disease anemia is something very much of a passion of mine. And Bethany completely understood all of the salient issues that affect adults with sickle cell and was completely behind ensuring that adults now in the state of Delaware have a community-based medical home where they can receive their care in. And as a nurse, and in my background, we don't just focus on sickle cell pain, but we treat the whole person. So it's not just their physical health, but their social, their emotional health, and their spiritual health. And it's an integrative, very innovative model. So now that children who transition out of A.I. DuPont Hospital have an option to receive their services at Tova Community Health. Back to transitional care, one of the things that I've learned is that transition for children who have disabilities, whether it's diabetes, children in foster care, children that have autism and other chronic diseases, parents have the same concerns. What happens to their child once they leave out of the pediatric healthcare system? And with the Complex Chronic Disease Task Force, one of the recommendations is that we have structured transition programs in addition to teach these children life skills, but not because they have a disability, but they can still work. And we want them to have meaningful lives and be a part of the community. So I'm really excited that we want to move forward with that. And also the fact that community health workers is a growing industry where we can put about over 1,000 people to work in the state of Delaware. And Bethany, you can talk more about that.
Well, that's part of my she's leading right into my 4-point health plan. I know we're not going to always talk about health, but remember, health affects our economy. It affects every facet of our lives and in our community. And she's spot on. I know Senator Henry, co-chaired that with Representative Stephanie Bolden, and they did a fabulous job. But if you go to my site, Bethany2016.com, you'll see my 4-point health plan, which includes this chronic disease and community health workers. They don't have to be licensed. They are like ambassadors from within the community. And working with the insurance company, there is a way and a model and our academic partners that we will be able to ideally, hopefully do this. And I'm going to hopefully have the opportunity to work with that with the governor. Having over the past 14 years done over 1,000 pieces of legislation, and probably 60% of it was around addressing some of these core issues. I'm just really, really excited. And the final thing I'll say about that, since we were talking about my plan, if you visit the website, I also have my plan for education and economic development. So
can you talk about those a little bit? What are your plans?
Sure, absolutely. Education I've touched on is really important, and I think we need, I know, and Senator Henry knows this from serving with the Education Committee. I did it in the House, I've done it in the Senate, and as a faculty and as a mom of a child who has learning differences. And I have tried all schools with a child. When you have a child who has a learning issue, private, public, charter, we have to. And we have to make sure all children, despite their zip code, have equal opportunity in learning. And this year, Tony Allen, Dan Rich, Mr. Street up here was very loud and vocal, and rightfully so. And I was pleased to support them, and Senator Henry, I know she was, with the whole Wilmington education reform. Ideally this year, after some more study, I was pleased to vote for it. I know you were too. It didn't quite make it over the finish line this year, but I'm sure it will this next year, that we can ensure that our kids have that. And not just middle school and high school, where we put wellness centers and counselors for mental health, because we need to start earlier with mental health, preventing problems, but early pre-K.
Yes.
As you recognize, Senator Henry has become an expert with her grandson, I know, with autism, how important those formative early years are. And if you're a busy mom or dad and you're working, you may not always have those tools and ability at home. And making sure that somebody has a sandwich for lunch or a food we just provided for early breakfast. So we really need to look at the whole child and not just these tests. And we need to make accommodations for kids.
Hold up for a minute. Say that again. Not only these tests. Say
Not
that again.
only tests. We got too many tests, and I can say that as an educator. We need to give children life skills. They need to be able to graduate, know how to balance a checkbook, go to work, take care of themselves. You know, it is important that they know math, that they know arithmetic. But Dr. Dusty Blakey, Colonial Superintendent, who's a little mover and a shaker, and we've got some great folks in the Christina district as well as others in the viewing audience, Brandywine. But, you know, he talks about the 3 R's. And it's not always reading, writing, and arithmetic, it's relevance, relationships, and respect. And if children can learn those early, we might end up with them being empowered with a career, ag, whatever it might be, culinary school, tools shop, hair salon, working instead of on the street. And that's what Hanifa Shabash and others with the CDC report in the City Council has found with the youth violence. These are young kids that if we had other things to keep them off the street, incentives, money, and rewards would hopefully eliminate a portion, wouldn't eliminate it all, but eliminate a portion of the gun violence that we have in the city.
I definitely believe that.
You know, there are so many people who want to come to Delaware, so we must be doing some good things too.
Yes.
Because we have an influx of people coming to Delaware to retire, which means that we need more healthcare professionals.
Yes, the
like
aging.
Doctor. We do. We have an aging population, but it also means that our infrastructure needs to always be looked at. Our roads, our bridges.
Yes.
And Senator Bethany Hall Long serves on the bond committee, and so I wish she'd talk a little bit about some of the things that we're dealing with at the state level.
And you're right. In Delaware, we are proud
Tell
to
them
say.
what the bond committee is. I call it the money committee.
The money.
Go
There's a
ahead.
couple different money committees. And the nice news, Senator Henry served many years and is a well-respected leader, and y'all in the city have a great champion here. She served on the operating committee. So it's kind of the cash in hand, paying your paycheck, so to say, you know. And the other committee is all those buildings around us and roads, the infrastructure, and that's called the capital bond. Our school buildings, our roads, the supplies, bless the firemen who recently were killed tragically, you know, making sure people had the radio equipment that they need, the tools that they need in the community, air conditioned units that work at, you know, our Delaware Psych Center, you know, making sure facilities are up to date. And so the bond committee is important, and you know from the port side, Port of Wilmington, giving that money so that we can reinvest, and that's what we've done, job reinvestment, schools, infrastructure, you know, really important. And Delaware, I'm glad the senator said this, you're hearing a lot of negativity on TV. You gotta go vote this year in this year's election because there's so much negative. We do a decent job. We're not perfect, we're learning, but we balance our budget because we have to. Our state constitution mandates, and we've been able to keep the best bond rating. And at home, you're probably thinking bond rating. Well, what that means is the best on how we can reinvest in our state. And there's levels like an A, B, C. Well, we've got a triple A, and we want to keep it that way. And thanks to our leaders like Harris McDowell and others, you know, Senator Sokola and others, Senator Blevins, Senator Henry, who work really hard to make sure that that happens.
I want our community to understand something. I mean, Dr. Bethany, not only she's a PhD, but she fights hard for blue collar workers. And believe me, again, this port deal, when the port was almost gone, you talking about a lot of jobs, and these ladies here are the champions of that. And so she does a lot for blue collar workers. And don't think she don't. She does a lot, and I want to say it again. I mean, she does a lot for blue collar workers.
Yes, absolutely. And the workforce training is all that, you know, and Margaret and, you know, Nina can tell you, that's why I champion. I went the model with the community health workers, innovation, bringing the funding in. My area that I represent in the Senate has been one of the fastest growing communities, and has included in Newark down to Middletown a lot of blue collar jobs. You know, we want to make sure that those blue collar jobs come, though. I was asked me today, very pro-union, you know, very strongly pro-union, very important to me. Good wages, good benefits, because that's what makes a big difference in a family.
I think you should talk about some of the endorsements you've received.
You know, that probably could do that. I've been fortunate enough to receive the building traits Council and early on, the Teamsters Union. I don't want to forget anybody. AFL, CIO. Been pleased because of my work with women's health, Planned Parenthood, my work in the community with faculty and teachers and staff and cafeteria workers and school bus drivers, people who affect our children, the Teachers Union, DSEA. And they also include, a lot of people don't know this, public health nurses. Okay. So my public health nurses are really important to me. And then here in the city, I know I would make some people very upset if I didn't mention my CBTU family.
Oh, yeah.
Coalition of Black Trade Unions, they've been supportive of me. And yeah, I know, they might be picking. See, we always, we're here together.
We're family, we're family. And, well, Senator Hall Long, we had, the government has a benefits committee, and she fought hard to make sure that labor had a position on the benefits committee, because when we're deciding state benefits, it's important that we have equality for all people.
Yes, Senate Bill 36.
Yeah, yes.
That was your bill.
Right, but you were a champion, and you really fought hard to make sure that we had labor.
To have that. And I was very honored to have groups because of my work in open space and farmland preservation, trails and biking, groups like the Sierra Club, have supported me, Progressive Democrats, the Democrat Committee.
Can I, again, Dr. Anderson, she has the first Thursday and the fourth Thursday, 8 to 9, that's going to be her TV show. She's going to talk about health. Can we make sure that you come back
absolutely.
And talk about health and different things that are going on? Because, again, write this down. The first Thursday and the fourth Thursday, 8 to 9, she's going to be talking about all kinds of different health problems and what's going on, how to get better.
And how to get access,
Right.
and that's important, how to get those services and to take care of yourself.
The new, I'm already owning it. The new lieutenant governor says she will be back.
I'll be chairing the health committee if not.
Right.
I still will chair that in the Senate.
She's definitely earned the right. And like I said again, she's fought hard for all of us. Hard.
I appreciate that. And the other groups, I've had other endorsements too, and I want to thank all of those. I don't have time to mention all of them this evening, but everyone has helped, means a great deal to me. And particularly, as Nina said, persons with disabilities, they have just been great and embraced me. There's nothing more moving than working at the polls and having someone who, can't move, but they're there in their wheelchair, sitting in their wheelchair with a shirt on, and that just moves me, and I want to thank them as well.
Can we talk about, you was in the newspaper, a nice article.
Oh, okay.
Talk about your articles, I think Sunday's paper.
We've had different
editorial.
ones, and that one, the title, because I've written different ones, is, Delaware must do more for those in need. And, that's just really about, to whom much is given, much is expected. And being raised in a house of ministers, you never let anybody, and I think anybody knows me, I'm a food pusher. You got to make sure everybody's got food and people are taken care of and they have a shelter and a place to stay, because we all enter this world, and Nina will tell you this, we enter the world the same. As a nurse, we see this, and we leave this world the same. And my article really basically talks about that and needing addiction services and making sure that as the next lieutenant governor, I vow to work with our governor. Obviously, I'm with John Carney and supporting him and his initiatives with education and economics and crime, that we can do better. And I'm proud to be a Delawarean. I'm proud to have had this opportunity to represent people. We don't take it for granted. Margaret and I, we sit there and we whisper back and forth and write each other notes, because that's what you do when it's kind of like sitting in class. We sit in the chamber, and she is a fine leader. You all have to be so honored, first African American woman in the majority leadership, as the whip. And she doesn't whip too hard, but that's a fancy term for keeping us organized. So she keeps us organized, but she's been open, and I have to say we're excited about this year of women. From Hillary Clinton to our sister, which we are so proud of, our trailblazing woman. She may not be listening to some of the viewers, or Miss Lisa Blunt Rochester. She is going to be a great congresswoman, but we got to get people out. We've got to get people out to vote, and people might not be happy at the top of the ticket, but we need the leadership. And I'm proud to be among strong women, Hillary, Lisa, and then certainly John Carney and Trinidad Navarro fighting for us on the Democrat ticket.
We have some good women who won with Shabazz.
Oh,
Yeah,
yes.
city, the
Hanifa,
city level.
We have Miss Charles Potter's wife.
Velda.
Velda, I'm
Sure.
sorry, I went blank.
Yes.
I don't like to do that. The new city treasurer.
Yeah.
Yes.
We had some. We had
Another
Miss
city
Dixon,
councilwoman.
Yes,
new
we have a
councilwoman
lot.
Dixon.
Yes,
Yes.
Mishima.
Yes, and
Yes.
Loretta Walsh, she's old champ. She's
Yeah.
just been around. So we had some women doing some great things.
And for those who aren't necessarily elected, but there's a number, we're really blessed, a number of women organizations and men as far as that goes, and health organizations. And without their feedback, without calling us, sending us notes, letters, and with our staff, because we don't do this alone.
No.
You know, we have a lot of nice people, and our church community. I cannot thank enough the faith-based community for what they do in stepping up and working with our veterans and our homeless and persons in need.
Now, what's some of the things that you would like, something that you see that you want to fix, that you would like to try to work on?
Well, you know, there's a couple items. You know, I think to the viewing audience, you know, I think the number one thing is making sure that people have enough money in their pocket, a good, you know, good solid jobs and education. To me, the first low-hanging fruit though, that we can really address are some of these things around healthcare and health costs, and that will affect the economy, and whether it's access to service, working with the chronic disease or seniors, or the mental health, substance abuse, addiction. One thing we can do right away is put workers on the street, come up with a program, pilot it perhaps in some of our high-risk zip codes, our community health workers, and pilot that. So that's a low-hanging. Long-term, we'd certainly be able to continue to do what Delaware's done. You know, we have lowered our unemployment, but again, making sure our children all graduate, that they all have an equal opportunity, because she knows my motto. You know, I talk a lot of times, you know, about Nelson Mandela. All children, you know, come into this world without knowing hate. Hate is something we learn. It's not about color. And I would love the opportunity to be one of those champions that shows my role reaching across the aisle, working with different groups, working in the community to make all of us stronger and better. All of us.
He just gave me a sign for 2 minutes. I want Dr. Anderson to say something, Senator Margaret Rose about Bethany, and then we're going to let Bethany finish up.
I just want to say to the viewing audience, it's been my honor to see Bethany grow in her professional career as a public health nurse, a professor, and also as a legislator. I don't think I would be where I am today doing the work championing a fight for a underfunded disease and a rare disorder like sickle cell anemia. And she's been there all the way. She completely understands the salient issues involving this population. And she is the only candidate that has the background and the experience to really be able to come in and get the ground running. And with her platform, I think we're very lucky to have her. And so I would encourage you all to go to her website if you want to find any more information and to get behind Dr. Bethany Hall.
Go ahead, Senator.
I just want to say that she has a servant's heart, and she cares about people, and she's there to serve.
Thank
You
you. Looks like
finish
we're
it
out
up.
of time.
Go ahead,
Just
no.
please consider us. Thank you so much, the whole Democrat ticket and myself. You know, it's been an honor to serve as a senator, nurse, and mom. I'm really going to fight to make Delaware stronger, better, and healthier. Visit Bethany2016.com. Go out to vote November 8th. Thank you.
Okay. And again, good night, everybody. And just remember one thing. These women here saved the Port of Wilmington. They saved the Port of Wilmington. We won by one vote. Again, good night, and we'll see you November the 3rd. That's the next first Thursday. Good night. Thank you.